And joining us now with more is Laura Ricketts. She's with the group And Then There Were None, which seeks to help abortion workers leave the abortion industry. Welcome, Laura.
Thank you. I'm glad to be with you.
The recent report is titled The Safety and Quality of Abortion Care in the United States. What's your main contention with this report?
Well, one of our main contentions is we are wondering why it's speaking to safety when in compiling the report, they failed to look at any of the medical safety reports that have been filed against abortion clinics.
Wow, anything else that you're upset with about this report?
It's also troubling that it seems that there is a lot of opposition against very common sense measures that states have tried to take to make abortion procedures more safe. Things like requiring sonograms, a waiting period, pre-op procedures that anyone undergoing any surgery would have to undergo. That's not an undue hardship. And yet, in the case of abortion, going through any sort of pre-op procedure is called hardship. That doesn't make sense to us, and that doesn't sound safe.
Most abortions happen in clinics outside hospitals. Do those clinics have to meet the same standards as the hospitals?
Every state has different regulations and laws regarding how abortion clinics are, how they're considered, whether they're considered to be medical facilities, or in some states like Alaska, they aren't considered medical facilities at all. I mean, let that sink in for a minute. You say abortion is a medical procedure, and women assume they're going to a medical clinic for a medical procedure, and yet the state doesn't define it that way. That's troubling.
Who can perform an abortion? Do they have to be a doctor?
That's sort of a loaded question, because I think if you ask abortion providers, if you asked Planned Parenthood, they would say, of course. However, we've helped over 430 abortion clinic workers leave the industry, 7 of them being doctors. In some cases, these doctors are not licensed. And that's a case right here in Virginia with a doctor who says that he's a doctor, yet he doesn't have a medical license and he's performing procedures. In some cases, we've had our clients who are nurses or who are medical techs or who aren't even licensed in any sort of medical field performing abortion procedures. So technically, you would think the answer is yes. Realistically, that's not always what happens. And again, these medical safety reports outline all of that.
Well, break it down a little bit more for us. What are the safety issues with abortion clinics?
Well, how long do we have? And honestly, this is why And Then There Were None started an initiative, and we have another website. It's called checkmyclinic.org. And we've compiled all of the safety reports, all of the medical, the complaints, Freedom of Information Act requests to different health departments in all the different states in the country. So you can actually look at the reports for yourself to see what the reality is in the clinics that are closest to you. But some of the things we're seeing over and over again when we review these reports are things like not sterilizing medical equipment, not cleaning the medical equipment or sterilizing it in between patients, medical technicians and nurses not wearing gloves, going from patient to patient and not changing gloves, not knowing how to work an autoclave machine. It's the machine that's supposed to be used to sterilize equipment. In some cases, there have been reports where the employees at the clinic didn't know if it worked or not. We have other reports that outline the disgusting conditions. In Maryland, for instance, there's a clinic in Hagerstown. There's a rat infestation. It is a known problem. It's not being taken care of. The rooms aren't sanitized in between patients. There's blood on the walls and on the equipment. This is just a small snapshot of a reality we're seeing over and over again with these reports.
So why do you think this most recent report ignored these issues?
Well, I can't speak to why they chose to not look at these medical reports. I can say that in looking over so many reports like we did when we put together checkmyclinic.org, we've noticed it's almost a systemic problem. And if you want to report on the safety of something, you have to make sure it's safe. And if you look at these reports, you can very clearly see that it's not.
Well, your group contends that it's not just the aborted baby and the mother who suffer, but abortion workers too. Talk a little bit more about that mission.
Well, we've noticed with And Then There Were None, and our mission is to help abortion clinic workers leave their jobs in the industry and find new work, find hope through healing, and really it's a whole new lease on life. And in doing this over the last several years, we've helped over 430 workers. And what we have found over and over is that abortion doesn't just take the life of the baby, alter forever the life of the mother and those close to her, but it hurts those who work in the industry too. Abortion, there aren't any winners in the abortion industry. Abortion hurts everyone it touches. And that's why we've realized that the most important part of our ministry is the healing aspect. More than the financial assistance, more than the resume help, more than the practical support that we provide, it's the healing. Because every one of our workers who comes out of the industry is in need of healing. Because you can't work in an industry like that, an industry that is surrounded by death, and not be touched and not need to heal from that experience.
All right, Laura Ricketts is with the group, And Then There Were None. Laura, thanks so much for joining us. We appreciate your time today.
Thank you.